हेलो फ्रेंड्स, मैं हूं आपका दूरबीन वाला डेंटिस्ट। तो गुड इवनिंग आप सबको, सत श्री अकाल, आदाब। और आज जो हमारा टॉपिक है लाइव के लिए। हेलो सर, गुड इवनिंग।
हाय, गुड इवनिंग।
सर कैसे
विजिबल?
हो?
एकदम
यस
ठीक।
सर,
दिस इज विजिबल।
बिल्कुल 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 सर। तो
ओके।
सर, जस्ट मैंने अभी इंट्रोडक्शन शुरू ही किया था कि आज हमारा
थैंक यू।
टॉपिक है कि वाई कंपोजिट फेल इन डेली प्रैक्टिस। और आज हमारे साथ ज्वाइन कर रहे हैं डॉक्टर प्रतीक गुप्ता सर। ही इज नोन एज द बायोक्लियर मैन ऑफ इंडिया। और सर एशिया के लिए बायोक्लियर प्रॉक्टर भी हैं। और सर ने डायरेक्टली डेविड क्लार्क सर के अंडर ट्रेनिंग भी लिया और बहुत सारी जो रेप्यूटेड ब्रांड्स हैं सर उसके लिए की ओपिनियन लीडर भी हैं। सो सर, थैंक यू सो मच फॉर ज्वाइनिंग अस इन दिस लाइव।
वेल,
एंड
थैंक यू फॉर हैविंग मी इन दिस लाइव प्रोग्राम। आई थिंक आई हैव टू स्विच ऑफ दैट लाइट, वो ज्यादा ग्लेयर कर रहा है। जस्ट अ सेक।
हाँ सर।
आई थिंक दिस इज बेटर नाउ।
हाँ जी सर, अब ठीक है।
जी। ओके। सो
तो
थैंक यू फॉर हैविंग मी इन दिस लाइव। इट वाज यू हु टुक दिस इनिशिएटिव। आपने बताया कि सर लेट्स डू अ कंपोजिट लाइव where let's not deal with regular composites but deal with their problems. And yes, I can
यस
understand that almost everyone, we've been through that. I mean, जब 12 साल पहले मैंने शुरू किया था, we've all
हम्म
been through these composite failures. We've seen our cases coming back, and then we've seen these things failing. We've seen
हम्म
problems. We've seen the patient's confidence going down, and more than the patient's confidence, their confidence on you goes down. Because
यस
हालांकि आपने सिर्फ एक फिलिंग किया है, but when he's paid you an X amount for whatever you've charged, he believes that this will last.
यस
क्योंकि see, we've all made those mistakes. Initially हम बोलते हैं कि ये चलेगा, this is the best material. We tend to rely
यस
on brands rather than the technique and technology. And पहले हम बोलते थे, no, we are using this particular brand's composite and ये टिकेगा. Previous dentist
यस
ने नहीं किया, I'm using a better brand and this will last. And when you make promises like that, and when eventually that breaks down, or eventually that boils down to the patient not trusting you, you've not just lost that little composite or little filling that you've done, but you've lost a patient as such. एंड
यस
भाई, मैं तो मारवाड़ी
एग्जैक्टली।
हूं, तो हमारे में एक कहावत है कि एक नहीं आता है, 10 लेके आता है।
बिल्कुल
और
ठीक बात है
एक
सर।
एक जब जाता है ना, 100 लेके जाता है।
बिल्कुल सर। सर इसमें एक ये भी चीज है, देखो इतनी सारी कंपनी है, इतने सारे कंपोजिट्स है, हर कोई बोलता है मेरा कंपोजिट बेस्ट है।
बिल्कुल बिल्कुल। और वो कंपनी का रिप्रेजेंटेटिव जो आज आके आपको बोलेगा कि मेरा कंपोजिट अच्छा है, कल दूसरी कंपनी ज्वाइन करके बोलेगा कि ये बेटर है। भाई, उसकी भी रोजी रोटी है। ही इज नॉट रॉन्ग इन व्हाट ही इज डूइंग, बट यू
बिल्कुल
हैव टू
बिल्कुल।
अंडरस्टैंड दैट इट्स द साइंस. Like we always say, it's not the arrow but the person behind the bow who hits
यस
the
यस
target.
यस यस एग्जैक्टली सर। तो सर, कमिंग स्ट्रेट ऑन द पॉइंट की हॉट टॉपिक क्या है
Yes.
सर? सेंसिटिविटी, सेंसिटिविटी आफ्टर द कंपोजिट रेस्टोरेशन। सर बर्निंग
Well,
क्वेश्चन है।
frankly, if you've done your composite well, this is one thing that
यस
shouldn't happen today.
यस
Forget about being post composite, even after you do your crown prep. If it's a vital crown prep, and I understand that in our country, not many people, or most of the people, do not give a temporary, which a patient deserves. Frankly, no
यस
patient should
यस
leave your
यस
clinic without a temporary. He deserves a temporary in his mouth. But even after that, the whole and sole idea of sensitivity lies behind three simple letters: IDS. इमीडिएट डेंटिन सीलिंग.
सील।
जो
यस
डेंटिन को आपने खोला है, जो ट्यूब्यूल को आपने डिस्टर्ब किया है, उसको सील करो. आप अगर उसको
बिल्कुल।
करेक्ट तरीके से सील करोगे, तो इवेंचुअली द पेशेंट विल नेवर कम बैक टू यू विथ सेंसिटिविटी. नाउ एज अ बाई प्रोडक्ट, व्हाट यू वुड गेट इज यू वुड गेट बेटर बॉन्डिंग टू द इनकमिंग सबस्ट्रेट. भले ही आप
यस
क्राउन कर रहे हो, भले ही आप कंपोजिट कर रहे हो, you will get a better bonding to that. And that is the whole and sole reason that you should be doing IDS. ये
यस यस
तीन वर्ड्स ना हर क्लिनिक में should be like a block letter. आप जैसे लिखते हो डेंटिस्ट, आर्टिस्ट, वो जो भी है, that acronym, वैसे ही IDS should be there as a part of your chair, that immediate dentine sealing is something that will save you. See, either you do IDS or you stay in enamel. ये दो ही चीज आपको सेंसिटिविटी से बचा सकती है. आप जब तक
ठीक।
इनामल में हो, सेंसिटिविटी नहीं रहेगी. अगर आप डेंटिन की तरफ गए, तो यू विल हैव टू डू IDS. नाउ कमिंग
बिल्कुल।
टू दैट, लोग सबसे commonly पूछते हैं which bond to use.
Yes, exactly.
That's the next question probably. Which bond do I use? Now,
Yes.
from tomorrow, when you see the tooth structure, let's see it as not as a tooth structure, but see it as different substrates. You will
Yes.
see it as enamel. You will see it as dentine. Now, in the dentine, you will have three zones. D1, which is closer to enamel. D2, which is the middle zone. And D3, which is the inner zone, which is very close to the pulp. Now,
Yes.
anytime you are in D2 and D3 dentine, please do not use an etch on dentine surface.
Okay.
Please do not use an etch on dentine surface. आप कोई भी bond use करो, and I'll speak about bonds, but do not use an etch on that dentine surface, because the moment you etch that dentine surface, the collagen fibrils become very, very fragile. और फिर आप etch wash करने को, you will wash it with the water and then you will put some air. The
Yes.
moment you do that, because that's in our mind कि उसको dry करना है, the moment you do that, वो collagen fibrils collapse हो जाएंगे. So if there is one takeaway from this is do not etch dentine, stay selective etch on enamel. Etching enamel is compulsory. You cannot forego etching enamel. But on dentine, avoid an etch. So for this, you will have to use a more viscous etch. You will not be able to use the regular etches that you get. Plus, please use branded products in these. Now, I know there are a lot of etchants in the market, right? But you would want an etch which stays put, which does the job. And frankly, I was given, let's not name brands here, I was given an etch to try. The moment I put the etch on the tooth surface, वो color छोड़ गया. And wash तो हो गया, but it left a residue behind. Now, I do not know for how long will that residue act. So what I had to do is take a burr again, refine the enamel again, and then you had to go ahead with the good etch. So please do not use these, I wouldn't call them low standard, but please do not use etches that do not have a history of them being present in the market.
सर आपने आईडीएस के बारे में बात किया. सर आईडीएस, मुझे ऐसा लगता है कि आज के दिन में बहुत सारे लोग हैं जो इसके बारे में, जो ये लाइव देख रहे हैं, कुछ नहीं जानते हैं कि व्हाट इज आईडीएस. तो हमें सर मतलब एक बेसिक, मतलब व्हाट इज आईडीएस, क्यों करना है?
जैसे 3 लेटर है, इमीडिएट
डेंटिन सीलिंग. यस.
आपने ट्यूब्यूल ओपन किया है, दैट डेंटिन ट्यूब्यूल इज ओपन with an etchant, with your burr, with whatever you've irritated that tubule. Now, if that tubule is open, remember the theory that we know, the hydrodynamic theory, इसके अंदर water है, इसके अंदर पानी है. तो आप जब कुछ भी चीज उसके ऊपर डालोगे, that water will get repelled. But it will not stay repelled, it will start to move in that tubule. And the moment that happens, the patient will come back with sensitivity, because in that tubule, you have nerve endings. Yes. तो जब patient उस पे bite करेगा, when the patient will chew on something, or even when he doesn't, when he has something cold. Now, there are two different parts here. Patient has sensitivity on cold, that means your restoration is leaking somewhere. Yes. Patient has sensitivity when he bites, when he takes a chew, or when he takes a bite on that. Then for that, he will either have a high point. That's one. The second part that he may have there is, apart from the high point, your bonding has not happened properly. Okay. Because then, जब भी वो bite कर रहा है, this water inside that tubule is moving. And now, yes. how do you prevent the water from moving? You will not leave behind a gap. And for that gap, you are doing IDS. In simple words, you are sealing that tubule जो आपने open किया है, मैं इसको resin से seal कर दे रहा हूँ. Okay. तो अब जब patient bite करेगा, जितना area था which was occupied by that liquid is now occupied by my resin.
ठीक है सर. अब बड़ा क्विकली सर, ये आईडीएस हम जल्दी से जल्दी करेंगे कैसे?
सो आईडीएस का सिंपल स्टेप है, यू विल टेक अ सेल्फ एच एडहेसिव. सेल्फ एच एडहेसिव लेना है और स्क्रब करते जाना है डेंटिन पर.
कितने सेकंड्स तक?
कितने सेकंड? या दैट्स द क्वेश्चन जो सबसे कॉमन आता है. कितने सेकंड्स डिपेंड्स ऑन द एच दैट यू आर यूजिंग. ओके. देयर इज नो गोल्ड स्टैंडर्ड टू हाउ मेनी सेकंड्स शुड आई स्क्रब द प्राइमर. It is written on that little white paper जो आप मटेरियल खरीदते हो, और छोटा सा white paper folded newspaper आता है ना, that's called the IFU sheet. And if you've heard my lectures, I say it actually means IFU. Got it. तो समझ में आ गया? If you don't read that, it actually means IFU. Yes. So when you read that little newspaper, when you open it, I know it's in multiple languages, go back to the language that you know. It is there in English. So you go back to English and you study कि मैंने आज ये बॉन्ड खरीदा है, हाउ मच टाइम डज द कंपनी रिकमेंड टू स्क्रब दैट बॉन्ड. ओके.
Yes.
So some companies would say scrub my bond for 10 seconds. Just a
Okay.
simple example, that bond might have acetone as the primer. Acetone
Okay.
evaporates quickly. So
Okay.
10 second ke scrub is enough. Some will say do not scrub, just apply and wait. Some will say scrub for 20 seconds. So there is no gold standard here कि 20 सेकंड
Okay.
एच करना है या 10 सेकंड एच करना है 10 सेकंड स्क्रब करना है. there's no, it depends on what you are using. So it
Okay.
depends on your self-etch bond that you are going to use. Now which bond will be the next question, right?
Yes.
So if you are an idealist like I am, you would always have your primer separate and you will have your bond separate.
Okay.
I would always
Right.
prefer the primer to be separate and I would always prefer the bond to be separate.
हाँ. Okay.
Adhesive alag se and the primer alag se. I wouldn't want them to be mixed. But today you have all-in-one bonds which are good. The only problem is they lose efficacy the moment you open the bottle. So आपने आज ये bond की bottle लिया, आपने इसको open किया. The moment
Okay.
this gets exposed to oxygen, it starts to lose its efficacy. So this
Okay.
bond on day 1 is not as good, is not equally good as it will be on day 60. Day 60 the bond would have deteriorated. So on day 1 I will have the most ideal bond strength.
Yes.
On day 60, because of the deterioration, because of phase separation, there will always be issues. So I am somebody who is an idealist and I like to keep my bond separate and my primer separate. So for that I will use a 6th generation bond. If you are asking me names, I mean some people are. The only answer to that is Clearfill SE bond or the Clearfill SE
Yes.
bond 2. Whichever.
Yes.
This is from Curare. That's the bond that I would prefer when I'm doing IDS.
Okay.
But if you want to make life simple and you do not want to invest an amount there, you can still buy a universal bond. You can buy the 3M universal bond, buy it from a good company. The 3M, the Curare, the Dentsply, all of them are good, but try to use up the bond as quickly as you can. So in my book,
Okay.
you should finish the bond in 6 months.
Okay.
6 महीने के बाद phase separation हो जाता है because it is constantly being opened. And please store the bond well.
Okay.
You cannot store it randomly anywhere where there is heat and stuff. When again that IFU sheet will tell you कि storage क्या है. Some of them will tell you 7 to 25 degrees. Some will say 2 to 16 degrees. Some will say 2 to 8 degrees. So that's the refrigeration you will have to store it at. अगर आप उसका storage ही बराबर नहीं करोगे तो वो चलेगा कैसे? So if you are using a universal bond, again follow the universal bond instructions. You do not need, ऐसे कोई definite नहीं है कि IDS के लिए Clearfill ही use करना है. You can also use the universal bonds, but make sure the bond is not very old. And वो जो bulk buying का खुजली होता है ना, because सस्ते में मिल रहा है, मत करो. Buy smaller bonds. If you get a 3 ml bottle, buy a 3 ml bottle, यार. Even if it is say 500 rupees expensive than overall, अगर आप calculate कर रहे हो, तो ये 500-600 रुपया expensive पड़ेगा. But I would prefer not to spoil my bond strength and take this, take the 3 ml bond and use it.
ठीक है सर. अब क्लियरफिल ऐसी आ गया मेरे पास, मैंने आपकी बात सुन के ले लिया है. अब what next?
So Clearfill SE has 2 parts, right? एक तो primer हो गया. That's when you will scrub for 20 seconds. And उसका एक part हुआ, which is the bond, which will be the bottle 2. Right? Now on enamel, you would have already etched enamel. Etching enamel is compulsory. That's where we began with. Etching dentine is optional and you're trying to avoid that to avoid sensitivity. So for that आपने क्या किया? What you've done now is taken the scrub.
सर एक सेकंड, एक कॉमन प्रैक्टिस है कि टोटल एच करने का.
हाँ, तो मैंने क्या बताया?
कॉमन प्रैक्टिस है.
जब भी आप D2 D3 डेंटिन में हो, प्लीज टोटल एच मत करो.
Okay.
Because वहां ट्यूब्यूल का डायमीटर और ट्यूब्यूल का डेंसिटी, that means number of tubules per square millimeter, is very high. Plus, apart from that, the diameter is very thick, so there will be more water. As simple as that. Now, there are a lot of chemistry that goes into this, but that's not for the general practitioner. आप और मुझे क्या चाहिए कि भाई मैं कैसे करूं?
बिल्कुल, बिल्कुल.
तो D2 and D3 dentine में हो, तो do not etch dentine. In fact, avoid dentine etching on D1 also if possible. So use a selective etch. अगर वो थोड़ा सा edge D1 पे जाता है, तो you can't help, but prefer the selective etch. On the deeper dentine, always use a self-etch adhesive. Please remember the term self-etch adhesive. Now, a universal is also self-etch adhesive.
Okay.
Universal is also a self-etch adhesive, but it's not a purist. It's not a purist. It's like विराट कोहली बैटिंग भी कर रहा है, बॉलिंग भी कर रहा है, फील्डिंग भी कर रहा है, सब कुछ तो नहीं कर सकता यार. You will have to segregate yourself. If you're a batsman, you're a good batsman. If you're a fielder, you're a great fielder. You could be a good bowler. You cannot. It is very rare to find an all-rounder which has a mix of all three, and you still have those all-rounders in dentistry also. यूनिवर्सल
yes,
बॉन्ड्स अवेलेबल है, ऐसे नहीं है कि नहीं
yes,
है,
yes,
बट
yes,
वो ऑलराउंडर की ना लाइफ कम होती है. यू नॉट सीन एन
hmm,
ऑलराउंडर प्ले फॉर 20 years. ये
yes,
याद रखो कि योर बॉन्ड हैज अ लेसर लाइफ व्हेन इट इज अ मिक्स, व्हेन इट इज अ खिचड़ी,
hmm,
व्हेन इट इज अ दाल चावल अचार पापड़ सब उसमें है, तो उसकी
hmm,
लाइफ कम हो जाती है, आप उसको स्टोर नहीं कर पाओगे. दाल को अलग, चावल को अलग शायद आप 2 दिन तक स्टोर कर पाओगे. मिक्स्ड सांबर राइस 2 दिन तक स्टोर नहीं होता है, दे स्टार्ट टू गेट रॉटन क्विकली.
hmm. तो सर कमिंग ऑन टू अगेन आइडियाज की हमने बॉन्ड ले लिया है
सो
अब
आपने
आप
आपने पहले you've taken the primer, you've scrubbed the primer good for 20 seconds. Let's
ओके
speak of any gold standard, they would say you 20 seconds of scrub. Now after the 20 seconds of scrub, they would want you to take air and air dry. अब
ओके
इसमें एक छोटी प्रॉब्लम है कि आपका जो 3-way syringe है उसमें मॉइस्चर जनरेट होता है.
यस
ठीक है,
यस होता है सर होता है
there will be water also that comes along. Now,
हम्म
what I generally want people to do at least is see, as now all the chairs have 2 3-way syringes, one that's on the assistant side and one that's on your clinician side.
ऑपरेटर यस
So
यस
on the assistant side, please cut off water from the 3-way syringe. You do not want
ओके
water in that 3-way syringe, and
ओके
use that to air dry. Use that to air dry. So what that will do is you will not have at least water droplets that fall onto this primer layer जो आपने अभी prime किया है. So please do not add water onto that. Next, in spite of this, if you are a true purist like me, in spite of this, you will still have moisture that gets generated because of your compressor.
ओके
Compressor line में पानी के साथ moisture generate होता है, which you cannot help. To avoid that, you can install something called as a dry air system along your
ओके
compressor.
ओके
ये क्या है? It is basically a desiccant. तो जो compressor की lining आएगी, it will go into the dry air and then it will come onto your chair. So what
ओके
that desiccant will absorb any moisture, any little moisture that would have got generated. And that's a purist. That's what I would do. But even without it, please cut off the water. इतना bare minimum तो सब कर ही सकते हैं. I mean, you may not
बिल्कुल
get a dry air installed in every chair, but you can do this. So at least cut off the water. And before you spray it on dentine, एक बार हाथ पर मार कर देखो कि there
कि
is
उसमें
moisture. Let the moisture
yes
get released and then put it on the dentine. Now you are
कैंटीन
completely going to dry this primer. Now how do you know that the primer is dried? It should stop moving.
ओके फ्लो नहीं होना चाहिए
Basically उसका flow बंद हो जाएगा.
हम्म
That means it's completely dry now. Now
बिल्कुल
once it is dry, you will take the bond now.
ओके
Please remember that this bond is an unfilled resin because it is clear fill. SE, it's a separate bond. It does not have any fillers in the bond. So you
ओके
will take the bond and you will apply the bond over the surface now. Now you will never air dry the bond. आपको
ओके
प्राइमर एयर ड्राई करना है, बॉन्ड को एयर ड्राई
बॉन्ड
नहीं करना है.
नहीं करना ठीक है
Because the moment you air dry the bond, two things happen. Air gets incorporated into that bond, which will act as an oxygen inhibited layer now. You're incorporating the bond air into the deeper layers. Second thing that could happen is आपका bond, because it doesn't have weight, might fall off. It might go away from where it's supposed to be. So
yes
what you will do is you will take a neat and clean micro brush, not the same one wiped out of cotton, please. No, take a new micro brush and nick off the excess bond. क्योंकि आपको bond pooling भी नहीं चाहिए. अगर bond pooling होगी, तो when you take a radiograph, you will see a black line below your restoration.
ओके
That means the bond has got pooled there. You do not want bond pooling also. So you will
Okay.
take off the excess bond. It should be a very thin layer. It's called a smear actually. It should be a smear. Remember जब हम वो in the histopathology lab we used to put 1 drop of the blood and smear it. बस उतना
Yes.
smear चाहिए आपको. So that's the smear that you would want on the
Okay.
dentine. And once that is done, light cure. Please buy a good light cure. वो Chinese light cures ना, they're not good, frankly speaking. There are 100 things that go into making of a light cure. So we've had light cures tested sometimes where light cure की intensity and on different meters, the light cure began with a very high intensity but dropped in 20 seconds. So उसकी intensity भी equal नहीं है beyond the 20 seconds mark that you are trying to do. So not something that you should be using. I mean, not those. So please use gold standard or good light cure units, good ones from the branded brands, and please keep checking your light cure for the intensity. Now light cure this bond for 20 seconds. Again, that's what the manufacturer recommends. Light cure the bond for 20 seconds. someone mentions that please save this video. Is that from your side? Will you be able to save the video, or they are able to save the video?
No, sir. I'll be able to save the video.
Okay, sure.
अब सर
Can we
इसमें अभी
air? एक question है नीचे. Can we air dry universal bond? Yes, you can air dry the universal bond. I mean, there's no problem with air drying the bond, but make sure that bond doesn't move. That's the most important thing. Another question is which brand light cure? Well, like I said, branded ones. So personally speaking, I use the 3M Elipar, and that's what everyone knows. I'm somebody who uses the 3M Elipar Deep Cure L, and it's been working with me for the last 8 years or 9 years now. And we had an intensity check last year, which we do every year, and the intensity was still good enough. So please use a good light cure that gives you, I mean, these are some investments that you make for, I wouldn't call it a lifetime, but at least a decade. You wouldn't want to keep investing on a light cure, and आपको पता भी नहीं चलेगा, because ultimately देखते क्या हो? Blue light
yes.
तो आ ही रही है. So you think it is still curing everything, whereas it's not. So please make sure you keep testing your light cure.
सर कमिंग ऑन टू अनदर टॉपिक, जो सबसे मतलब एक बर्निंग क्वेश्चन है सर कि क्लास 2 रेस्टोरेशंस.
जी.
तो सर मतलब व्हाट्स योर टेक ऑन दैट कि व्हाई पीपल आर नॉट एबल टू डू अ प्रॉपर क्लास 2? व्हाट इज द रीजन?
Well, the biggest problem with people not able to do a good class 2 restoration is they use the wrong matrix system.
Okay.
And see, whenever you will hear my name, it will be synonymous with Bioclear. पूरी दुनिया को पता है that यहाँ लिखा है Bioclear. यहाँ लिखा है Bioclear. But I mean, it's not just about Bioclear. It's about understanding your contact, understanding your contour, and then probably getting the right result. You will then put it at the right place, put it at the right contour, and then get the result. So it's not just Bioclear, but you have brands like Dentistry, which have a good matrix system, Parodent. You have the brand called Garrison, which has excellent matrix systems.
Yes.
So you have multiple things that are there. And the most important part is you get a good seal. You use the correct matrix system. You use the correct bonding and use the correct composite.
Yes.
Now, apart from all of this, you will have to check the structure of the tooth. यार ये सब तो ठीक है. अगर the tooth is not able to withstand the shrinkage, it is eventually going to fail. So you will have to understand the tooth structure.
एक similar question है, class 2 and food lodgement.
जी. Again, class 2 and food lodgement. So my point is, if you're doing a class 2 and the patient has a food lodgement, why do the class 2?
Yeah, exactly.
Create a spillway so that at least he's able to clean.
Self-cleansing area बन जाए.
Yes. And the whole and sole idea behind all this when you do a class 2 is to get a good contact and is to get a good contour. So start reading contacts, start seeing preoperative contacts and see where you are looking to get. And then you can look at the matrix system that you are going to buy or you're going to put in that particular system. Now, every now and then there's one question. Is there one universal matrix system that I buy and I forget? One universal matrix system was only with amalgam. जहां आप प्रोफाइल मायर लगाते थे और पूरी दुनिया जीत सकते थे.
बिल्कुल.
With composite, you cannot. You will need at least 3 different types of matrix systems. And I like to call this the matrix selection ladder. You've been through there. And we like to call it either they are flat in emergence or slightly curved or super curved. And then you choose according to what the case is presented with.
नहीं सर, इसमें अब अमलगम की बात चली सर. देखो अभी प्रिपरेशन तो अमलगम का हो रहा है और उसमें भरा कंपोजिट जा रहा है. So what's your take on that?
Not just that. अमलगम ना इतना डीप सीटेड है कि आप कंपोजिट को भी लेयर करते हो अमलगम की तरह. इतना डीप सीटेड है अमलगम. एंड देन यू गिव अंडरकट्स फॉर कंपोजिट कि रिटेंशन मिलेगा.
यस.
कंपोजिट को रिटेंशन की जरूरत नहीं है, कंपोजिट को बॉन्डिंग की जरूरत है. Composite requires good bonding, requires a good substrate. Once you have a good substrate, your composites it's not going to fail. And there is one difference that when you do with amalgam and you do composite is isolation. I cannot stress on the importance of isolation here.
Sir, मेरा next question ही यही था कि what about isolation? What role does it play in?
There is no composite that you can do. Now, isolation begins and ends with a rubber dam.
Yes, exactly.
There is no other go, except for in a class 1 situation where you can say, okay, I might get away with just using the modern roles, so appreciate that, but acceptable. That's acceptable, but you will never ever do a composite restoration without a thorough isolation. A rubber dam is bare minimum. वो requirement भी नहीं है. It should be your armament area that begins. जैसे आप anesthesia दोगे वैसे आप rubber dam लगाओगे.
बेसिक प्रोटोकॉल.
बेसिक जैसे आपको लाइट क्योर करना है वैसे रबर डैम लगाना है बस. These are things that are mandatory, so there's no going around. Now there will be some situations where you cannot isolate.
Yes,
I mean you will come to situations where you cannot isolate, where you are not able to get a thorough isolation. Now in those cases you have materials that are slightly forgiving. They do not require 100% isolation. So you could use a bioactive material like Activa, and that's what we commonly promote, because that material, and I'm not saying that material should be used without isolation, but it's a slightly forgiving material than when you compare it with composite, because composite is plastic here. Yes. And that plastic requires absolute isolation.
Isolation, yes.
Absolute isolation. Whereas if you do not have absolute isolation, say a distal of the 7, you're not able to isolate thoroughly, and up thoda sa leakage hai wahan par, and all of that, then in that case you can probably get along and use Activa, and you will still tell the patient that please do not give any promises here, and I've tried my best, and we hope and pray that this lasts. Otherwise, see, we are in a country which is slowly getting on to ban amalgam. It's still not banned, and frankly, amalgam is not a bad material, and I can understand it's a very economical material. So you can still use amalgam. Do I use it in my practice? No, and I'm not preaching here to use amalgam, but again, that's a material that could forgo isolation, that could forgive the fact that you're not isolating 100%. Although if you go back and see SC Barnum did amalgams, and that's the guy who's invented rubber dam. He did amalgams under a rubber dam.
एंड सर उसके बाद हम एक कैरीज डिटेक्टिंग डाई का क्या रोल है? एंड सर कैरीज एक्सकवेशन अफेक्टेड डेंटिन, इन्फेक्टेड डेंटिन, हाउ टू?
आई थिंक अभी एक क्वेश्चन था वेयर दे आस्क्ड कि is selective caries removal enough to do a composite restoration? I just scrolled through that question. So yeah, again, the importance of a caries detector dye is to not remove caries 100%. See, that concept is gone. The original idea of the dye was to remove the entire thing. But now the dye has moved to a part where you're not removing the complete restoration, but you are selectively removing and leaving a part of the caries behind, which is on top of the pulp.
Yes.
Now, you can go back and follow something called as the 3x5 rule, which was very made pretty common by Dr. David Alleman and his associates. That's what you can follow, and you can leave caries behind. But this caries is only on top of that pulp. See, today we believe that the pulp can regenerate. We know all of it.
Yes.
And if you injure the pulp, it will not regenerate. Any biomaterial that you put over it will stop regeneration. It may create regeneration at a later date, but abhi ke liye it will stop that regeneration. So to use the pulp to the maximum potential, you are doing selective caries removal, and for that you have the dye. The dye is to help your eye basically. You could have caries that has been left in corners jo aapne socha nahi tha. That dye helps you in removing. It is not to remove the entire restoration or the entire caries. And here comes your second part of your question, which is this infected and affected dentine. Well, logically, you leave behind affected dentine and remove all infected. But today, you do not follow the infected affected dentine concept. You leave behind even infected dentine, even if you have to leave behind not to expose the pulp. That's called the selective caries removal or the modified Hall's approach that we use in Bioclear.
Bioclear, okay. तो उसमें सर हमें को मतलब कोशिश करना है कि पल्प को हम टच नहीं करें.
पल्प के आसपास आप caries छोड़ सकते हो, but everywhere else it has to be pitch clean. And for that you will apply the dye not once, twice, thrice, until there is no dye taking up in the peripheral area, and that area is now called the peripheral seal zone. You've created a peripheral seal.
आप word use करते हो pristine clean.
It has to be pristinely clean. That means you cannot have caries, you cannot have any infected area left behind. आपको see, आप जब किसी को घर में बुलाते हो ना, हो सकता है कि घर का इंटीरियर खराब हो, बट आपके घर का एक्सटीरियर परफेक्ट होना चाहिए. That's what creates the first impact. And then as
yes,
he enters, he might not get into your bedroom. He will sit in the dining room. He will sit in the living room, and that you decorate that to the best of your ability. यहाँ पर वैसे ही है. Inside the living room, inside the dining room, that means until D2 dentine, everything is pitch clean. At D3 dentine, I can leave caries behind. Now, there's a question there that says, leaving infected DK will eventually lead to RCT. Absolutely not. So this is like a border fight that is going on between bacteria and yourself. What are you trying to do? You're trying to. There was a situation where you are surrounded on all sides by the army. There is nothing left for you to go. And we all have heard of the story of Padmavat, where Khilji
yes,
came along and he stayed at that place until they were completely deprived of the food, and they had to
yes,
eventually come down to fight.
yes.
ये वैसे ही है. You're depriving the bacteria of the food, and once you're
Okay.
depriving them of the nutrients of the food, the pulp below will regenerate. That's how it leaves behind tertiary dentine. Tertiary
Okay.
dentine का concept ही वही है, that the pulp is always regenerating, and that is why when you see atreted teeth which have gone slow attrition,
Yes.
you will
Yes.
eventually see a pulp stone.
Yes.
Pulp stone है क्या? It's the body's ability to lay behind tertiary dentine. Body is sealing itself from the stimulus.
Yes. नेचर का
वही तो
रिस्पॉन्स
है,
है.
वही
Yes.
तो आप कर रहे हो. It's the pulpal response. और
Yes.
यहाँ पर भी वही है. It's the response of the body to prevent the infection from going inside. Keeps laying behind tertiary dentine on the top, and the bacteria gets sandwiched between your seal and the seal that the pulp is doing. And that's why
Yes.
today we've got long-term follow-ups with selective caries removal. Almost the last paper that I read was 12 years of follow-up, and the success rate was 96%. It's a classic article by Dr. David Jadol and his associates. Very good article, if I remember the name correct. It's a very good article which gives you 12 years of follow-up of deep margin elevation and deep caries, both of them done. 12 years of follow-up, and they did overlays and onlays and the partial restorations, and they followed it up for 12 years. Now, if that can last, I believe that this can do.
Okay. So the thing is कि सर हमने पेरिफेरी क्लीन कर दिया,
जी,
चाहे इन्फेक्टेड हमने एरिया छोड़ दिया, उसके बाद हमें आईडीएस करना है. Then we have to do
100%.
IDS.
Yes.
Then we have to restore the tooth.
Restore the tooth.
सर अभी एक मैं कमेंट सेक्शन में क्वेश्चन पढ़ रहा था सर कि थेराकेल एलसी एंड दिस टाइप ऑफ मटेरियल्स ये हमने कहाँ यूज करने हैं सर?
So I mean, see, in spite of you trying all of this, कई बारी हो सकता है that you will expose the pulp.
हाँ.
It's not in your hands.
Pinpoint exposure है.
Frankly speaking, you are working with a device that's at least rotating at 2 lakhs RPM.
Yes.
अगर आप एयर रोटर यूज कर रहे हो, अगर आप
Yes.
माइक्रो मोटर यूज कर रहे हो, तो यू आर एटलीस्ट रिवॉल्विंग एट अराउंड 25-30,000 RPM. भाई हम एक दूसरे की जबान कंट्रोल नहीं कर सकते, which is at 10 RPM.
Yes.
Forget about controlling a burr that revolves at 3 lakhs RPM. So you could have that little area where you just snap and nick. Or even if you're using a spoon excavator, sometimes it's so soft that you kind of expose the pulp. So that is where you will use the Theracal, they will use the biodentines. Those are for inadvertent exposures. It is not for exposure that you are making wantedly, especially when you are dealing with deep caries and the tooth is vital. However, if the tooth is non-vital or partially vital, वो concept ही totally अलग है.
Okay.
That concept is entirely different. But when you are dealing with a vital tooth, where you are looking and गलती से exposure हो गया, and that could happen with anyone. Even the best of us have those exposures. See, pulp आपके control में नहीं है. You do not know where a pulp horn would be. Even after using smart burrs, even after using stainless steel burrs, you will sometimes have a little exposure that has happened. In those cases, you will use Theracal. And Theracal is only to be used on that exposed area. पूरा liner की तरह नहीं है. The new concept says no liners and no bases. It is just over that exposed pulp.
And sir, we both are assuming कि this we are seeing under magnification.
Yeah, obviously, that's something that's non-negotiable. Like the rubber dam, when you are dealing with deep caries in these cases, then you are absolutely doing it under magnification. At least a 5x magnification when you are dealing with cases like these. 3.5 is not even enough.
Okay. And sir,
another question is, can we use Theracal near to pulp even when there is no pulp exposure? Why would you want to do that? I mean, it doesn't make sense. you're using a material that is designed to be used on the pulp, and then the material doesn't work properly. तो कोई मतलब नहीं बनता है. Smart burrs के regarding question है, well, smart burrs are good, expensive.
But they are not. अभी इंडिया में availability भी थोड़ा issue है.
I mean, I'm sure there are people from abroad also looking, and you could have used a smart burr and stuff. नहीं भी मिलता है, you can source it. See, अगर आपको इच्छा है ना, वो शाहरुख खान का एक है ना, सारी कायनात पीछे लग जाएगी वैसे, you can source it from anywhere. Sourcing is never a problem. So that's one thing that you will definitely be able to source. But even then, it's an expensive proposition. See, a smart burr roughly would be around 350 to 450 rupees, depending on where you are and where you are buying from. And it works hardly for one case or maximum two cases. The moment, the whole idea is the moment it touches your active dentine, it should become a blunt surface. And the burr doesn't work the same way the second time. A smart burr, someone asked me, what are smart burrs? Smart burrs are basically, these are polymer burrs manufactured by SS White and multiple other companies. I think Comet also manufactures one. And these are supposed to remove only infected dentine and leave behind affected dentine. That's the entire concept.
Okay. And sir, coming on to, what about heating composites?
That's something that I've been promoting for around 10, 12 years now.
Yes.
You know, when I began, we did not have a formal heater in India, at least. So we used to read a lot of articles, and the article said 55 degrees. You know, मेरा पहला heater क्या था? My baby's bottle warmer.
Okay.
Nice. Suddenly उसका IFU sheet पढ़ रहा था. उसके साथ भी IFU sheet आता है. तो IFU sheet पढ़ रहा था, जिसमें जो keep warm temperature होता है, that's 55 degrees. तो मैंने मेरी wife को बोला, you buy one more and I'm taking this to the clinic. Because that's the temperature that I want to start using at.
Yes.
That was 55 degrees. That was my first warmer. And then इसके बाद दिमाग लगाया, I went to a parlor shop and they were using digital wax warmers. That was my second warmer. But the temperature was never perfect. The temperature that I got with this Philips, so this was a Philips bottle warmer, Philips Event ka bottle warmer, and this was the perfect bottle warmer for 55 degrees. But then as studies evolved and as composites evolved, we now know that there are composites which are heat safe and you can warm it to 70 degrees. And that's the temperature that we at Bioclear recommend to warm your composites at.
Okay.
But please make sure your manufacturer recommends the fact that his composite is heat safe. Not all composites agree with warming.
Okay.
3M, आप आँख बंद करके warm कर सकते हो. Any composite from 3M can be warmed, especially the nano composite range can absolutely be warmed. So the Z350, the Filtech posterior, all of this can be warmed. But some companies still do not recommend warming their composites. I mean, I've warmed every composite under the roof and I've had no differences, but still when the company doesn't recommend, I'm not someone who can go beyond the company and say कि आप हर चीज को गर्म कर सकते हो.
So basically, what is the benefit of heating a composite?
So there are multiple benefits when you warm your composite. एक तो it will flow better. सबसे important. So into that nooks and corners where the regular composite would not have flown, this will flow. Second, it increases the depth of cure. Enough studies to tell you that the depth of cure increases. Third, you will get better strength of the composite. See, the turnover of the composite increases. That when I say the turnover, the conversion of monomer to polymer is always more.
Okay.
When you have a better turnover,
shrinkage कम होगा.
Shrinkage कम होगा because आपने उसको preheat किया है.
Yes.
Relatively, and this is not me who's speaking. There are a lot of articles out there. You put heated composite on today we speak of Chat GPT, and you can put articles related to heated composite, and you will get an entire chart. Chat GPT ना उसका answer भी आपको दे देगा. So you will have enough. So there's less micro leakage. There's increased depth of cure. There's better strength. There's better flow. What else would you want in a composite? Now another thing that you could do is use the same composite to lute your inlays and onlays because now it flows.
Okay.
So you have better strength there. Again, your cement in the clinic, I mean, your inventory drops down. There is one little problem though when you warm a composite. It becomes a more stickier proposition.
Yes.
It becomes more sticky.
बिल्कुल sir. Experience किया मैंने. Yes.
Yes, it becomes more sticky, and that's why we say do not warm your syringes. Use compules.
Compules. Okay.
So Compule, you will directly use it and put it in the mouth. You are not going to take it out from a syringe, take it out on a pad, beat it on a pad, and then pick it up from there and put it in the mouth. Please don't do that. Directly use composites that can be put in the mouth. That's a Compule for you. Now, advantage. Someone asked me why would you prefer heated composite over flowable? Flowable obviously has more shrinkage. Heated composite would be paste or an injectable, which will have lesser shrinkage. Overall shrinkage will be less. जब shrinkage कम है, stress कम होगा, दांत पे strain कम होगा. Simple logic. Stress and strain.
And sir, coming on to another topic कि sir patient आया, आज हमने उसका restoration किया.
जी.
Shade was perfect, matching. तीन दिन के बाद पेशेंट वापस आ रहा है कि ये तो दांत मैच नहीं हो रहा है.
Two reasons. It could be yellowing that you see.
Yes.
Now, yellowing of the composite on the top is because of something called as oxygen inhibited layer. जो top layer of composite है, when it is in contact with oxygen, never cures. So that means that 35-40 microns on the top layer, it's not cured. It will bond to anything that it comes across. And Indian food में एक सबसे common additive है, which is called haldi.
Yes.
Turmeric. Now that is one thing that can stain the composite left, right, and center. इसीलिए 2 दिन में patient आएगा with a yellow colored composite, and that's because haldi. अब आप patient को ये तो नहीं बोल सकते कि हल्दी मत खाओ. Again, another problem that I see is we've been trained in accordance with the European and the American standards, so we never speak about haldi. हम patient को बोलेंगे wine मत पी. कितने लोग इंडिया में वाइन पीते हैं? हम पेशेंट को बोलेंगे जाके चाइनीज फूड मत खाओ because it has additive colorants. हम पेशेंट को बोलेंगे do not have black coffee. These are all good to hear, but it's not practical in the Indian conditions where not many people would do all this. I mean, you'll still have a section of people who will do it. But what's most common is people use haldi. Now, to avoid this, you will have to apply a layer of glycerine or KY jelly on the top layer and cure it under KY jelly. When you do that, now there is no more oxygen that touches.
Yes.
So it's a complete anaerobic condition, and then when you are light curing it, there is complete turnover of the material. And second thing, please polish. जब आप polish नहीं करोगे, so there is rough surface of the composite which will attract bacteria, which will attract not just bacteria. We're speaking of stains here. It will attract stains.
So polishing composite itself is a complete science.
It's a complete science. I mean, we will require one full webinar to understand polishing of composites and how you are going to go through the sequence. But whatever you do, please follow the steps.
Sir, basic, quickly, sir, polishing protocol. What is your polishing protocol? What do you do in your practice? How you polish?
Any polishing protocol is getting the surface from a rough surface to a smooth surface.
Smoother surface,
logic वो है. So you will start with burrs.
Okay.
It could be carbides, it could be diamonds. You will start with burrs, then eventually move to composite polishers. The spirals that we get today are good enough. And then finally you will finish it with a polishing paste. Burrs, spirals and pastes. ये in general एक sequence हो गया.
And finishing and polishing both.
सब हो गया. So I like to call it the 3-step, where it is pre-polish, where you are doing it with a burr. Then you are using the pre-polish. That's the finishing. Then you would do the pre-polish with your spirals and final polish with the polishing pastes and buffs. So pre-polish and final polish.
Absolutely, sir. Sir, and one more thing, the demarcation line. The visible demarcation line after composite, it is a big problem.
So if you are getting a white line along your composite restorations the moment you start polishing, that's because the enamel rods around the margin have not been beveled.
Okay.
So please bevel the enamel margin, and after you bevel any margin, please polish it. Now, how do you polish it? Use the polishing spirals for a composite. And then do your etching and bonding. That's one. The second reason is that the composite shrinkage is in such a way that it's more and the tooth surface is not able to hold it. Now for this, we will have to get into how you are going to do bonding, how you are going to make sure that you are putting up in layers and you are not bonding to enamel and dentine together. Bond to dentine separately, bond to enamel separately. वो सब सारे steps है. But these are two primary reasons of the demarcation line. The third reason is your composite shade has not matched.
Okay.
And that's one of the primary reasons in the anterior where you will get a demarcation line. Or you've not used enough opaque composite. Because
Okay.
composite, so you have different shades. You have enamel, you have dentine, and you have the opaque shades. If you're not using them in the correct layer, just enamel se agar aap build up karoge, so it'll always be translucent. Opaque will be jet opaque, that has to be opaque, and then and dentine is between all of this. You also have a body shade, which is between
Yes.
enamel and dentine shades.
Yes.
So I mean, you will have to understand enamel layering, you will have to understand dentine layering, and then you will not get that little white line along your restoration or a proper demarcation line.
And sir, coming on to you follow the concept of injection molding, and
Yes.
there is also a concept of layering.
Yes, absolutely.
तो मतलब सर एक अभी बिगिनर है जिसने अभी कंपोजिट सीखना है, तो what would make his life easy?
I mean, you can still do layering. There is nothing against layering.
Okay.
It is a time-consuming fact, but sometimes layering is beneficial because it doesn't apply stress on the tooth. Now, if you have a
Okay.
large cavity, layering is sometimes more beneficial than completely injection molding the entire cavity. If you are a
Okay.
beginner, until you understand how injection molding goes.
Hmm.
So it's always better to layer those cavities. Now, in small cavities, you tend to save time when you're doing injection molding. You're not going to spend a lot of time on layering every little area. Even when you do all of this, just remember one thing. When you're connecting enamel to dentine, these are two different material, two distinct
Yes.
substrates.
Yes.
We began
Yes.
with substrates, we will end with substrates. Substrates are very, very important. So when you're
Yes.
bonding to dentine, you do the IDS first, build the dentine layer, and then connect it to enamel. ये एक काम compulsory करो. IDS becomes very, very important in this. After IDS, you will do a bulk dentine buildup if you can, and then connect it to enamel. Do not do both of them together because enamel or dentine bond entirely differently to the same.
Entirely different. Yes. 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 सर एक इसी टाइम से सर एक बात याद है कि सर कितना टाइम लगता है आपको एक मतलब बढ़िया क्लास 2 करने में अपनी प्रैक्टिस में, हाउ
So
कितना टाइम लग
I am
जाता
a great proponent of something that I've been teaching for quite some time now called the 1 hour appointment.
है? 1 hour appointment. Okay.
1 hour appointment. I mean, I schedule my appointments to 1 hour. If I am doing a quadrant of composites, I would ideally recommend 2 teeth at a time, but sometimes patient doesn't have time and you would want to do 4. That's a quadrant. For that quadrant, you would schedule 1.5 hours. Because frankly, na 45 minutes ke baad, after 45 minutes, this will stop working.
Yes.
It just goes into a total shut. Total shut. आप कितने भी अच्छे हो, you will make mistakes after 45 minutes. Now, in this 1 hour appointment, my most important take back for you guys is train your assistants.
Okay.
In dentistry in India, we do not train assistants well enough.
Yes. Yes.
And we do not have trained assistants. So आपका जो पहला 15 minute है ना, that's the assistant time where they are setting up the entire room. They have your composites and everything ready. आप जो use करोगे, they have the warmer switched on. You as a person, if your mind is traveling everywhere, कि मैंने warmer on किया नहीं किया, कि मैंने bond correct निकाला नहीं निकाला, कि मैंने कौन सा composite warmer में डाला है, which filling material I'm going to use, which polishing agent I'm going to use. You are too much clouded with thoughts.
Yes.
So you need a good team. For that, have an SOP. Have a protocol ready. That as my composite, when I'm doing a posterior composite, this is what I'm going to use. This is what I'm going to do. For an anterior, this is how I'm going to do. So your team works with you. It's not just you that you are going to work, because eventually, if you are the only person who's working, you're going to tire quicker.
Yes, exactly.
एक सचिन कभी वर्ल्ड कप जीत नहीं सकता था.
नहीं,
You need
सर,
the entire
बिल्कुल,
team to
बिल्कुल.
win the entire match.
बिल्कुल सर, ये जो पॉइंट है सर टीम वाला, दिस इज सो क्रूशियल, बिकॉज ये भी सर एक बहुत बड़ी प्रॉब्लम है आज के दिन डेली प्रैक्टिस में कि
Yes.
you are always short of staff.
Always. And there is one reason for it. You don't pay them enough. You absolutely don't pay them enough. Staff needs to be
Because
paid
सर
well
उसका
enough.
सर उसका कारण है
आप
we
खुद
don't
charge नहीं
charge,
करोगे.
we don't charge enough. Yes.
So ultimately it reciprocates down to the same thing. Na? You don't charge
Yes.
enough.
Yes.
So if in that 1 hour appointment you are charging an X amount and I'm charging 5X, doing the same job, it's not that I'm earning 5X more, but I'm spending on my team around.
Yes. Exactly.
It's very important that you understand that your system of protocols or the entire protocol list has to begin with a team. It cannot be individual. You're not just the only person who's going to work there. And trust me, if you are the only person who's going to run that marathon, वो रिले टीम ही जीतेगी जो बाजू वाली है। आप सिंगल मैराथन कितने भाग लोगे?
नहीं सर. And coming on to charging, sir, may I ask you, what do you charge for composite restoration?
I'm sure what I charge is quite a lot, because my practice is restoratively based, and I'm very proud to say that. I
Yes.
save teeth, and if I'm saving something, I need to charge well enough. But let's
Very well.
not get into what I charge on what you charge.
Yes.
Let's
Yes.
get to this 1 hour appointment that I was speaking of. And let's understand how do you come up with your charges and what you should be charging.
Okay.
Now this 1 hour appointment, kal aap baitho, say you work 20 days in a month, random.
Okay. Okay.
I'm giving you a random expense that you have 2 lakh rupees as an expense, and this 2 lakh rupees includes the salaries of your clinic, aapke sare salaries, your light bills, whatever is the clinical expense.
Yes.
So 2 lakh rupiya ho gaya, and you are working for 20 days. So first 2 lakhs divided by 20, that means 10,000 rupees a day.
Yes.
And if in a day you work for 10 hours, so your cost per hour is 1,000. 1,000 रुपये आपका cost per hour हुआ. ये एक side रख लो. That's standard for anything that you will do.
Okay.
Now let's come to a restorative thing. Say randomly speaking, the materials that I use, including the wear and tear, and you will have to ultimately look at the wear and tear of your clinic, or depreciation is that it's called. Your wife is a chartered accountant. She'll help you with the depreciation, I'm sure. So
yes,
you understand depreciation, and you would put that as an added cost to this. So randomly, roughly, I would call that if you are working 10 hours and if you're working 20, whatever I've just done, 1,500 rupiah is your charge per hour. That's your standard charge.
Base price.
Base price. Base भी नहीं आया है अभी.
अच्छा.
That's your expense without doing anything. अगर आप 1 घंटा खाली भी बैठ रहे हो तो 1,500 रुपए उड़ा रहे हो.
Okay, done.
Even if you are sitting in the clinic not doing anything for that hour, you are spending 1,500 because that's your running cost.
Yes.
Now on top of this, you will add the cost of the material. आपने material खरीदा से this composite is going to cost you around 1,200 rupees, 1,300 rupees, or whatever. That is how you will calculate based on bond में कितने drops निकलेंगे plus wastage. आप एक compule में कितने कर पाओगे, on the equipment that you've bought for it, on the finishing, how much. So on a rough estimate, a composite would get if you're doing with Bioclear, would get to you around 800 to 1,000, 1,200 rupees, depending on which matrix you are using and how. So 1,200 rupiah. Let's standardize that to $1,000. $1,000 plus 1,500 rupiah आपका previous expense. Again, that previous expense is different for everyone.
Yes.
It's not the same, right? Now my rentals will not be same as your rentals. मेरा पेट और आपका पेट अलग-अलग है. सब अपने हिसाब से चार्ज करेंगे. So you will standardize that cost. That's about, so if I put that to perspective, that's about 2,500 rupees that I've put at an expense. Now I'd randomly say, yeah, at least charge 2 to 3 times of that.
Yes.
Only then you are making dentistry profitable. अगर आप charge नहीं कर सकते तो stop doing dentistry, let the other person charge. Because if you undercut on these costs, overall the standard of dentistry goes down. And let's be honest about it. It's not something that has to be behind walls. Ki, no, I charge well enough for this X procedure and I do not charge. Now, if you're doing a root canal procedure in that 1 hour, and the cost of your root canal equipment goes to 2,500 rupees, that means your base cost is 2,500 plus 1,500. That's 4,000 rupees. ये तो आपका bare minimum cost है यार. और अगर आप root canal 3,000 रुपए में कर रहे हो, I do not know what standard of dentistry you are going to follow.
सर वेरी वेल सेड सर कि चार्जिंग का तो सर ऐसा है, देखो हर एक का अपना अपना है
100%. इसीलिए मैं ये नहीं बोल रहा हूँ कि इतना चार्ज करो. मैं बोल रहा हूँ आपका कॉस्ट पर आवर ऐड करो. एंड सी एज अ पर्सन आई वुड ऑलवेज ऐड द इनकम दैट आई वुड वांट इन द होम आल्सो.
यस.
I'll add my home EMI, I'm whatever it is, मैं सब इसमें ऐड करूंगा ना. खर्चा तो क्लिनिक ही निकाल के देगा भाई.
बिल्कुल सर. खर्चा
और कहाँ से निकलेगा? So if that's your primary earning source, you will have to get your expensive right up there.
Yes. And sir, coming on to sir, अभी बहुत सारे fresh graduates हैं जिनको अभी composite सीखना है, और आप a selective armamentarium, 3-4 things कि जो मतलब होना ही होना चाहिए, non-negotiable.
So non-negotiable here is using a good edge first. Let's start from the top to the bottom.
Okay.
Use good quality burrs. use a good quality aerator. Let's begin from there.
Okay.
क्योंकि आपका अगर burr already damaged है, and you've used it in about 5-6 number of patients, and now you're getting close to the pulp, that burr is going to generate a lot of heat.
Yes.
वो काट कम रहा है, irritate ज़्यादा कर रहा है.
Yes.
So it's going to generate a lot of heat. So use a good quality. Again, the aerator is also very important. The aerator needs to have enough torque for it to cut. It has to have enough torque for it to cut. So good aerator, good burr sets, these are primary things. And then use a good etchant, because ultimately, like I said, आप best composite use करो और आपका bond अच्छा नहीं है, तो ये तो fail हो जाएगा. So use a good etchant, use a good bond, and then use good gold standard composites. Do not use the ones that do not have a research backing to them.
Okay.
It should be in the market for at least I would say 10-15 years. अगर 10-15 साल का research backing है, then it's worth it. Otherwise, my only question here is, would you use a composite that's been launched 1 year back without any research backing in your wife's mouth or in your daughter's mouth?
No.
If you will not put it in your daughter's mouth, how can you put it in someone else's daughter's mouth?
Yes, exactly.
And mind you, your daughter or your wife is not paying for your expenses. The other daughter is.
Yes, exactly.
So apart from that, now you have a polishing system that you will need to buy. So buy a good polishing system. I mean, the 3M, the E-twist, these two are something that immediately come to the mind when you speak of polishing. Both of them are real good spirals. The E-twist and then finally, you will take a good polishing paste. Something that strikes the mind immediately is Diashine. Diashine has a beautiful polishing paste, diamond-based polishing paste and buffs. So you need these basic armamentarium. Now, in the middle of all of this, you will need Bioclear.
Yes, the metric system.
The metric system.
Yes, that is most important.
Yeah, absolutely. Because unless you create a proper wall, you remember with amalgam, we could create amalgam bridges. When I say amalgam bridge, दो back-to-back class 2 होते थे, and I've seen cases where the amalgam was dumped between them like a water bridge. Yes. And that amalgam lasted, but composite will not last. Composite is an irritant to the gingiva. Unless it is well polished. Now, how do you polish the composite around the gingiva? You don't need to. Your matrix will do that for you.
Yes.
If you have a nicely polished matrix, when the composite touches that matrix, it will get polished. So that's why you are not going to hand put composite in those areas.
And sir, coming on to matrices, Bioclear matrix system, why do you like it so much, and what is so special about it?
I mean, with the Bioclear now, you've got an entire range here. You can begin with the base matrix system, that's the Bioclear HD, which will get you through almost 80% of your cases. But then you now have the Evolve. We've evolved, as we like to call it. Now, Evolve has 3, like I said when we began, you need those 3, one flat, one super curved, and one slightly curved.
Yes.
Evolve has all of these 3 in one system.
Okay.
So now, technically speaking, I could finish off 95% of my clinical class 2 cases with only one system. That's Bioclear. But वो अगले 5% के लिए you will need 2 more systems. One thing that you will need is a deep margin elevation matrix, because those margins that are deep sometimes are difficult. And the other, you might use a saddle matrix, especially when there is the 7 distal caries.
Distillation,
where
yes.
So in those cases, the saddle works very well.
And sir, just compiling it, कि सर एक चीज जो अभी से बंद करना है अपनी प्रैक्टिस में while you are doing composites.
Well, bad light cure.
Bad.
That's one thing. आप सब कुछ perfect use करोगे और आपका light cure अच्छा नहीं है, तो your composite at the base is not curing ever. If that composite at the base is never curing, the moment you finish, you already have an eclair chocolate in the mouth.
Yes.
Eclair chocolate का क्या मतलब है? ऊपर से hard, अंदर से soft. You will immediately have micro leakage.
Okay.
So if there's one thing that you have to change, get your light cures tested and buy a good light cure. आज composites that are there in the market are good enough. Good